Y'all, I woke up this morning and it was not cute. I was so puffy. I was like, this is a great day to do a video about swelling in pregnancy. And I know exactly why. It was the pizza. Hey guys, welcome back. It's Leah and you're watching Mommy in the Moment. So today we're going to talk about swelling in pregnancy and all the ways that it can kind of rear its ugly head. Like I said, I woke up this morning and it was not a cute situation. My husband told me I snored worse last night, and I know it was because what we had for dinner. But first of all, if you are not subscribed, go ahead and take a minute, press the subscribe button, hit the notification bell. I'm putting out 2 videos a week on motherhood, pregnancy, lifestyle, and hopefully it's something that you can vibe with. All right, guys, so first of all, why do we swell during pregnancy? Why does this happen? Your body, your physiology is reset to retain fluid. So your body wants to increase your blood volume, okay? So all of your hormones, your kidneys, all of these things change to help your body keep that fluid in. So you're gonna increase your blood volume by 1 or 2 liters while you're pregnant. And your hormones help you to do that. But the other thing that happens is that the concentration of your blood goes down a little bit. So your actual blood cells, the protein in your blood, that stuff decreases, which allows that water to kind of sneak out of the blood vessels and get where it's not supposed to be in your other tissues. And that can cause swelling in places where you normally wouldn't have it. Now, how does this swelling show up whenever you're pregnant? It can show up in a lot of different ways. The most common way is swelling of your feet, ankles, the lower part of your leg. You get puffy at the end of the day. You wear sandals and you can see the strap, or you see socks. You wear socks and you can see where the sock was kind of pressing in on your foot. But there are many other ways that swelling can show up as well. Like we talked about in one of my embarrassing pregnancy hack videos, you can gain fluid in your nasal passages and your throat. That causes me to snore whenever I'm swollen. You can actually have your hands will swell. A lot of people, their ring stops fitting whenever they're pregnant because just generally speaking, you have more fluid in the tissue of your fingers. You can have carpal tunnel. I mentioned this in one of my videos on kind of less commonly discussed pregnancy symptoms. You get fluid that retains in this fixed space in your wrist, and it causes you to have tingling in your fingers often at night, or weakness in your hands. That's from fluid retention during pregnancy. Another thing that can happen is your vision can change. You actually get fluid retention in your eyes and in the lining of your eye. I'm actually gonna pop up a picture of my eyes this morning, guys. It was so bad. It was so bad. And I could feel it, the tightness in my eyeballs. That's called corneal edema. That can change your vision. And your vision changes can last for the entire pregnancy. It can also stay while you're breastfeeding if you breastfeed as well. So all of those things can be ways that swelling presents itself during pregnancy. But the main question is, what do you do about it, right? So one is elevate your feet. Whatever is swollen, pick it up. So I sleep on my right side, and that's the side of my face that was the most swollen this morning. And then when I got up throughout the day, it got a lot better. If you have swelling at the end of the day after work, put your feet up. Try to raise them above your heart, or at least above your waist. And that can help to decrease the swelling. Also, especially if you're up on your feet a lot doing work or things like that, use compression socks. I ordered some from Amazon that I love, and they really help during the day for me not to have a lot of swelling at the end of the day. I don't like the compression on my feet, so I just get the calf sleeves. Ooh. I just get the calf sleeves, and that works better for me. Move. The more active you are, the better your circulation will be, and the better your body is going to be able to keep that fluid moving to the places where it's supposed to be, and is less likely to pool where it's not supposed to be. So whether you work in a situation where you have prolonged standing, which can cause fluid to pool in your legs, or prolonged sitting, where you have angle at your knee, angle at your hip, and it's just harder for that blood to get back where it's supposed to go. Getting up to move frequently during the day is gonna really help keep your circulation going. Now, my holy grail tip for myself, but also for others, is watch your salt, watch your sodium, okay? This is what causes me to puff up like nothing else during pregnancy. And I think people don't realize how much salt is hidden everywhere in our diet. My weakness is pizza. I love pizza. I don't know, I'm a teenage boy. I love pizza. And every Friday we'll do pizza in a movie with the kids. And I was like, you know what? I'm just gonna do it. I didn't eat much salt earlier in the day. I'm just gonna do it. And I just went too hard, y'all. It was terrible. So I snored and I woke up with swollen eyeballs. And that's my punishment for eating too much pizza. But yes, decrease the amount of sodium that you take in, because wherever salt goes, water follows. So you'll be swollen for a while, and eventually your body's gonna get rid of that salt, and then you're gonna get dehydrated because you're gonna pee and pee and pee. So either way, it's not a great balance. So decrease your salt, really look at labels. Anything in a package, in a bag, is gonna have a lot of salt in it. Soup in a can, most vegetables in a can, unless it says low or no sodium, it's gonna have a lot of salt in it. Dinner rolls, sometimes bread actually has more salt than you might imagine. So really look and see how much salt you're taking in and see if that makes a difference for you. The other thing that I do as far as salt is concerned is you gotta hydrate, guys. You gotta drink. The water is gonna help you flush that salt out and help that all that water to keep on processing through your kidneys and you pee it out, okay? The last thing, I don't know if this really helps or not, but it feels amazing, is I used like a Jade Roller. Now mine is a little quartz thing I got from Marshall's, but it's cold and you just kind of roll it on your face and it helps to kind of, I guess it's supposed to help to depuff your eyes. I just think it feels great. And so I use it, and I use a little roller until it feels warm and it's not cold anymore. But that's something that you can always try. It just feels amazing. It's kind of like you're pampering yourself. Now, important point, when is swelling abnormal and when should you get it checked? Now, if you have swelling that does not go away whenever you elevate your legs, plus your blood pressure is elevated, or you have headaches or changes in your vision, like spots and floaters in your vision, you need to call your doctor about that, okay? That could be signs of preeclampsia and you need to be evaluated. If you have swelling in one leg that's way bigger than the other, sometimes you can have a little bit more on one side than the other, usually the right. But if you have one leg that's really swollen and it's tender and it hurts, and the other one is fine, you need to call your doctor about that, because that can be a sign of a blood clot that's decreasing the circulation in that leg. So make sure that you're being cautious about those dangerous signs of swelling, which can be difficult because swelling is so normal and so common in pregnancy, okay? You guys, thanks for watching. If you enjoyed this video, if you thought it was useful, give it a thumbs up, all right? Share it with somebody who you think might benefit from it. And if you haven't already, stop right now, hit the subscribe button, and then hit the notification bell. Excellent, very good. All right. All right, guys, I'll see you in the next video. Bye.